Well, good afternoon. The fight against this virus has taken a massive toll on people, on families, and on our economy. The economic reality we're facing is unprecedented, and no province can get out of this alone. And for months, Canada's premiers have shared these concerns with our federal partners. We've made it very clear that we need them at the table. In Ontario alone, we estimate that it could cost up to $23 billion to deal with the impacts of COVID-19 and safely reopen the economy. That estimates include healthcare costs tied to COVID-19 response, funding for needed supply of PPE, funding for municipalities, supporting our most vulnerable in long-term care and child care costs to support families. In short, there's a massive need in Ontario, up to $23 billion. And we've made it very clear and a full ask to the federal government. We're ready to work with them, and I know they're ready to work with us too. And today's announcement from the federal government, it must be the start of the conversation, not the end. We've identified up to $23 billion in costs for Ontario alone and $14 billion for the whole country. It's a start, it's a good start, and I thank the Prime Minister for his support. But the reality is, we have a $23 billion problem in Ontario and $14 billion for all of Canada. It won't solve the problem. $14 billion for all of Canada just won't cut it. And I'm committed to working with the federal government on this. And today's job numbers demonstrate that we can't find Band-Aid solutions to the massive issues we will face in the coming months. Our path to a strong economic recovery cannot happen without a strong healthcare system to support it. And Ontario taxpayers send $13 billion more to the federal government each year than we get back in federal transfers and services. And during these unprecedented times, through these unprecedented challenges, we're asking for just our fair share of that money. We need that contribution for critical investments, and we need the flexibility to fund our most pressing priorities, because every province has their own needs. We need a sustained long-term commitment. Our frontline healthcare workers are counting on it. Our municipalities are counting on it. And our long-term care residents are counting on it. And we can't do it alone. We need the federal government's help on this. My friends, we're making steady progress, and we'll be ready very soon to take our next steps in restarting our economy. But it won't happen overnight. Businesses will need some time to prepare. So early next week, we'll share more details about Stage 2 of the reopening of our province. To be clear, Stage 2 will not begin immediately. We'll be giving notice to businesses to start getting ready. Next week, we'll also lay out a phased plan for reopening childcare safely and gradually, so we can support parents as they return to work. I know the people of Ontario, you've been very, very patient. And as much as Stage 2 will be focused on getting people back to work, it is also about finding ways to try to get life back to normal this summer, even if it's a little different than before. I'm looking forward to sharing more details early next week, and I hope everyone has a wonderful weekend. Stay safe, and God bless the people of Ontario. Now I'll hand it over to Minister Fedeli.
Thank you, Premier, and good afternoon. With Stage 1 of the reopening of the province underway and more people returning to work, the Ontario government continues to support businesses and workers impacted by the COVID-19 outbreak. Today's job numbers show that our province's economy is beginning to stabilize. Statistics Canada data indicates that Ontario has regained 13,700 manufacturing jobs and thousands of jobs in the construction, food services, real estate, finance, and resource sectors. However, there is no doubt that the COVID-19 pandemic is having an ongoing impact on Ontario's economy and real people, families, business owners and workers continue to struggle. Through our Ontario Jobs and Recovery Committee, we are working hand in hand with business leaders to help them get through this difficult period. Our lines of communication with Ontario's business community and workers has always been open, and never more so than right now. And we've heard loud and clear, COVID-19 has changed the landscape, and we must work together. Throughout this time, Ontario's business community has continued to step up and demonstrate the best of the Ontario spirit to strengthen our supply of much-needed PPE. Through the Ontario Together portal and the Ontario Together Fund, we have mobilized Ontario's manufacturing might. More than 25,000 submissions have been received, resulting in over 17,000 emergency supplies leads that have been converted into more than $230 million in purchases. In growing numbers each day, we are seeing businesses helping businesses, frontline workers, and communities with Made in Ontario solutions. We have a solid foundation on which to build our future and emerge stronger than ever. We have the right framework to further reopen the economy in a safe way. We have the right guidelines to protect workers. We're going to get Ontario working again as quickly and safely as possible. Thank you, and now I'll pass it over to Minister Phillips.
Thank you, Minister Fedeli, and good afternoon, everyone. While there are signs that the economic situation in Canada is stabilizing, there is still uncertainty both in Ontario and around the world. What is clear is that we need to continue to do everything we can to ensure people and businesses get back on their feet as quickly and as safely as possible. Getting Ontario on the path to a successful recovery will continue to be our focus. A successful recovery means a safe reopening, and that is exactly what the framework to reopen our province is doing. But we are going to have to continue working together with our partners at every level of government. It is a positive sign that the Prime Minister has indicated the federal government will provide additional resources to support this work. The strong partnership between our governments has been key to getting us through the peak of the pandemic. They'll be just as important going forward. And reopening will require additional spending. When I talk to business leaders, scientists, and medical experts, they tell me that the strength of our public healthcare system, personal protective equipment, contact tracing, and testing are key to giving people the confidence they need to re-engage the economy. The tragic situation in our long-term care homes across the country requires real partnership with the federal government. And we've heard loud and clear from municipalities about the pressures that they're facing. The Federation of Canadian Municipalities has said that nationally, municipalities will need $10 to $15 billion as a result of COVID-19. Part of that is due to decreased transit ridership, and we know that ensuring people's confidence in safe transit is key to getting our economy back up and running. We've been listening, and we've been clear that the province has a role, and it will play it, in helping municipalities. But so does the federal government. Reopening Canada's economy safely is the national priority. And I can tell you that Ontario and other provinces are going to need significant support from the federal government. The $14 billion the Prime Minister has offered is not enough to address the magnitude of this challenge. I will continue to engage the need for more support with my counterpart, Minister Morneau, as I know the Premier has and will continue to with Prime Minister Trudeau. As the Premier announced, we will be providing more details for our plan on Stage 2 early next week. While our fight against COVID-19 continues, we will continue to do everything we can to ensure people and businesses get the support they need. We'll work together with our partners from both the federal and municipal governments, and together we will get the people of Ontario back to work. Thank you very much.
So before I start, Ivana, I just want to give a shout out to a group of seniors, and especially Gwen Wild. And she's at Churchill retirement home. And every day, I was told, they get together at 1 o'clock and they have popcorn. And I hear they have a little glass of Sherry and watch this show, and I hear this from so many people at 1 o'clock. They're glued to the television. So Gwen, thank you for watching. And Gwen had one complaint. This doesn't go long enough. So they get their popcorn ready. They want it to keep going longer. But thank you, Gwen, and thank you everyone else for tuning in. And before I move forward, I just also want to remind everyone that tomorrow is D-Day, and on Sunday is Canadian Armed Forces Day. So please, I just want to thank all of our women and men in uniform for serving today and in the past, for their dedication and commitment to our freedom. You are true heroes, and on behalf of all of Ontario, I want to thank you for your service. And I encourage all of you to take a moment this weekend to thank our armed forces. They're incredible people. So we're ready for the questions.
Okay, we'll go to the phone line for questions. First question
will be from Laura Stone at the Globe and Mail. Please go ahead.
Hi, Laura.
Hi, Premier. On the $14 billion announced by Prime Minister Justin Trudeau today, I heard that as an offer, not a negotiation. So what happens if the federal government does not provide more money to the provinces, and why is it on Ottawa to pay Ontario's bill?
Well, it's not necessarily up to Ottawa to pay the bills. We need the support. All the provinces do. And I just want to remind everyone, we're paying more to the feds than they're paying back to us. It's very simple. A lot of provinces are maybe taking a little more, but Ontario, your tax dollars, Laura, everyone that's listening, $13 billion are going to the federal government, and all we're asking is our fair share of the federal transfers. So we just hope that this is just a start of a conversation, and I think the feeling's mutual with the premiers. But most of all, Laura, we need the flexibility to be able to spend that money where it's needed most, because, and every premier agrees with that comment, has mentioned it twice now on the phone conferences, that what the needs of BC aren't necessarily the needs of Ontario, and what the needs of the East Coast or Quebec or Saskatchewan and Alberta and Manitoba. So we all have different needs, but we need that flexibility to spend it wisely in the most required areas.
follow up.
And the Prime Minister said today that this funding would be for targeted transfers, and one of the areas he mentioned was paid sick days. Mm-hmm. What is your position on sick days in Ontario, and if you don't support them, why not?
Well, I don't support it. We have legislation that protects jobs of people if they, again, if they don't feel safe, they don't have to go into work, and that's a priority for BC. But there wasn't too much take-up on that right across the country, to be very frank. I'd rather put those funds to long-term care. I'd rather give money back to municipalities, the 444 municipalities. And that's a perfect example. We have 444 municipalities that are in need of funds, and other provinces that are smaller, they don't need those needs as much as we do. They don't have, a lot of these provinces don't have the large urban centers outside of a few. That's where we need the support. We need, again, the support in long-term care as well, healthcare. So there's a lot of areas that are much higher priority than that.
Next question
will be from Haley Cooper at News Talk 1010. Please go ahead, Haley.
Hi, Haley.
Hi, Premier. So it's up to $23 billion is what's needed to help the province recover from COVID-19. So during your discussions with the Prime Minister and Deputy Prime Minister, have you been given any sort of commitment to that figure, or even a partial amount of that figure?
No, outside of the figure that he mentioned last night on the call with the premiers, he mentioned $14 billion, and it's just not enough. I'm grateful. Don't get me wrong. We're very grateful, but you spread that across Canada, it doesn't even cover Ontario, not to mention Quebec. We have large populations with a lot of needs, and as much as we are grateful, I just hope it's the start of a conversation, not the end of the conversation.
Follow-up?
And my follow-up, there's a petition that's growing online from salon owners, and they just really want an answer as to why people can't go and get a haircut, but they can go and get a massage, or they can go to the dentist.
Yeah, that makes sense, but what I'm going to do, I'm going to pass it over to Minister Fedeli to answer that, but I don't disagree with you.
Thank you very much. As the Premier said in the opening remarks, we'll be looking at an announcement regarding Stage 2 sometime next week, and there'll be more details about what that includes. And so we're all looking forward to the Premier's announcement next week. Look, there are many sectors that want to open right away, but we're always going to take the advice of the Chief Medical Officer of Health, the advice of our Minister of Health, the advice of all of our health professionals as we continue our cabinet discussions on what our essential business is. Thank you.
Next question.
From Lisa Shing at CBC News. Please go ahead.
Hi there,
How
Premier.
you doing?
I wanted to follow up on your announcement on the Youth Council yesterday. Your government's record on anti-racism has been criticized, especially in recent days. So if you think systemic racism exists and needs to be tackled, then why say eliminate a ministerial position on anti-racism, and why not make it mandatory for each ministry to collect race-based data, especially health, that a lot of experts and advocates are pushing for?
Well, first of all, I'm going to respectfully totally disagree with you. I actually sat down with Jamil Javani, which what an impressive young man, what an impressive speaker. And as soon as I met him, the first time I met him, I offered him a job immediately. It's very, very important to this government, and race-based data on health. I'll pass it over to the Minister of Health.
Well, we haven't traditionally collected race-based data on health, but there are a number of organizations that have come to us to ask us to do that. We are doing that in that it is up to local public health units to collect that information, of course, with the consent of the person that they're speaking with. And we are working with the Anti-Racism Directorate to set up a broader framework in order to be able to collect that in a meaningful way, and of course to protect people's privacy and confidentiality. So it is something we are working on as an active project, but right now local public health units can collect that information on a voluntary basis.
Thanks. And my follow-up is also for the health minister. We've learned of at least one death now of a family member of an infected healthcare worker, and of course the multiple deaths of healthcare workers themselves. So as more areas reopen, will the province be doing anything differently to protect these workers who clearly are still at risk?
Well, of course, first of all, it's a tragedy that anyone has lost their life due to COVID-19, but especially our frontline healthcare workers who, of course, really are the heroes in all of this, going to work each and every day, wanting to take care of their patients, their residents, worried about their own health and worried about the health of their families. I know in many situations there have been frontline healthcare workers who have really sequestered themselves away from their family even when they go home because they don't want to present any kind of a health threat to them. What we're doing and what we've continued to do from the beginning of COVID-19 is produce personal protective equipment that people should be wearing. I know that there are some concerns now that even as it's been supplied provincially on a regular basis and according to their inventory, all they have to do is order it. I know that there have been some situations where it hasn't been made available to the frontline workers in whatever location where they're working. So we are dealing with that. We have hospitals in some situations that are now supervising in some long-term care homes. But in every home, in every healthcare location, we need to make sure that personal protective equipment is available according to whatever procedure is being done by the frontline worker, and we want to make sure that continues. But of course, we've also brought forward a new testing strategy where anyone who feels that they have symptoms of COVID-19 or is concerned that they've been in contact with someone with COVID-19 can go to an assessment center and will be tested. And we are following up with contact management as well. So all of those issues are really very important as we start opening up our economy for the protection of everyone, but in this case, particularly with respect to frontline healthcare workers.
Next question.
Will be from Jessica Smith at Queen's Park Briefing. Please go ahead.
Hi, Jessica.
Hi, Premier. So you've spoken many times about finding efficiencies in government and running the province like a business, yet we keep hearing about inefficiencies in the province's COVID response that are causing major problems. For example, the test results are being sent by mail and fax to Toronto Public Health, and they're being flooded with duplicate reports, delaying their contact tracing efforts, allowing the virus to spread. So why haven't those problems been fixed by now?
Well, let me start going back 12 weeks ago, and that goes for all the provinces, maybe to the exception of BC. They started a little earlier, but where we've come now since 12 weeks ago, we have PPE. We've overhauled our whole procurement department. Look at the testing. I want to thank the Public Health and Ontario Health for the incredible job they've done. 22,000, they set a record, 22,000, actually over 22,000 tests. We're working with a phenomenal tracing app that I think and I hope that the federal government is so impressed they're going to pick it up too. So when you hit a pandemic and you know there's an inferno happening, you do your best to make sure you put it out and then be prepared. And then look at our hospitals too. Our hospitals are in better shape now than they've been in years for capacity. So we learned a lot, absolutely, like the whole world has learned a lot. Do we have a long ways to go? 100%. And we're going to continue to drive efficiencies. And good point about the faxes. You know, we have an antiquated system down here that we inherited, but we have a whole team focusing on digitizing this province and finding and driving more efficiencies. And so we're on this, but I understand your question. There's always room for improvement, and we aren't going to stop. I believe in continuous improvement.
Great. Can you commit, as a follow-up, can you commit that the province will have these kind of systemic problems and inefficiencies fixed by the fall in case we do get a second wave at that time?
Well, it's ongoing. We've come such a long way from now, and we still have months to go. So are we going to even improve more? Absolutely, we're going to improve more, and we're going to make sure that we have a good supply of PPE. I'll give you an example. 3 months ago, 12 weeks ago, we're relying on foreign governments, foreign leaders telling us that they aren't going to ship N95 masks. Now we have 23 companies all bidding to do N95 masks manufacturing here. We have gown manufacturers manufacturing. We have shield manufacturers manufacturing shields, and they also have hand sanitizer companies. So we're doing incredible. Once we start ramping up, and I'm the first to admit at the beginning, it caught the whole world off guard, caught us off guard, and now we're becoming a well-oiled machine. But let me be very clear. There's a tremendous amount of work still to be done. We aren't even close yet. A lot of room for improvement still.
Next question.
From Cynthia Mulligan at City News. Please go ahead.
Hello, Premier.
Hi.
This question is for my colleague Brandon Rowe, who is working on a story about gynecology. So I'm not sure. It might be the health minister that is best suited to answer this. So he's been speaking to one Toronto gynecologist who's nervous that now that they've been deemed an essential service, the already massive backlog for surgeries is getting even bigger. And in the state of New York, they've allowed non-invasive surgeries for gynecological issues in clinics. And there are a number of facilities in this province that can do this. Would the province consider allowing this so women can get the proper medical care that they need?
Yes, well, thank you for the question, and it is something that we are turning our attention to every day, that we know that we are behind in a number of procedures and surgeries, gynecological cancer surgeries, heart surgeries, and many others. And so we are trying to balance that with the work that's being done by many hospitals in going in to help either with staff at long-term care homes or in supervising long-term care homes. But we know that there are many people who have been waiting for these procedures for a number of months. They're very anxious about it. We want to make sure that we can start moving on that backload. So that's one of the issues that we're taking a look at really from a regional perspective, because there may be some hospitals that have a lot of staff that are being redeployed to long-term care homes, but there may be another hospital within that region that is able to start conducting those surgeries and is able to have that operating room space to be able to do that. So we're looking at that. We are looking at proceeding with those surgeries. One of the issues related to that is that where we might have been able to conduct 3 heart surgeries, for example, in 1 operating room per day, we now know that we won't be able to do that many because of the strict disinfecting procedures that need to be followed in order to make sure that it's safe and healthy in order to be able to do that. So we're looking at all of those factors, and we're looking at other places within the community where some of these procedures can also be done. To get back to your question, to be able to take some of these procedures, do them in some of these other community facilities to open up that hospital operating room capacity.
Thank you, Minister. My next question is for the Premier for my follow-up. And yes. Premier, right now there's a peaceful protest, yes, an anti-racism protest marching through the streets of Toronto. Toronto Police Chief Mark Saunders made a very symbolic, powerful move by taking a knee. I'm wondering if you would comment on that, what your thoughts are on the Chief of Police doing that, and is it something politicians should do? Is that a symbol some politicians should do as well?
Well, I always encourage a peaceful and safe protest or march, and I think that's important. That's how you get your voice heard. But I emphasize the word peaceful, and I have a great deal of respect for Mark Saunders, or I should say Chief Saunders, showing incredible leadership. I saw the picture, and man, that was impactful. Seeing that's what you call true leadership, is what the chief did. And I wish we could keep him around for another 5 years. He's doing a great job, and that's leadership. He's down there. So I appreciate that. And as for politicians, that's really up to the politicians. If they want to do that, by all means. But I just appreciate everyone being peaceful there. Thank you for that.
Next question.
From Sean Jeffords at the Canadian Press. Please go ahead.
Good afternoon, Premier.
Hi, Sean.
Just to follow up on Cynthia's question about the marches that are taking place today. I know you're praising Chief Saunders' leadership today. Do you plan to meet with any of the demonstrators today? And I'm wondering what you would say to them in the face of criticism that while your government is recognizing systemic racism in this province, that perhaps it's not doing enough to address it.
Well, I think we can all do more as the public, as right across this country. We can always do more. And to answer your question, no, I haven't planned on meeting him. But if I were to meet him, I'd first of all, thank you for the peaceful protest. Our country was founded on protests and getting your voice out there. So it's important they get their voice out there, and we're listening. And I think that's good for them.
Follow up.
Premier, I want to follow up on a report that the Registered Nurses Association of Ontario has released today that looks at all of the reports that have been done on long-term care and the problems in the system over the last 2 decades. They say these reports largely have been unimplemented, and I'm wondering what you will do to ensure that the commission that you are on the verge of appointing in a month does not end up doing the exact same thing, issuing a report that goes unimplemented.
Well, first of all, I believe in accountability. And if there's ever anything people will be held accountable for, not just myself, but all the premiers across the province, and to be very fair, down in the U.S. as well, we're going to fix the problem. we're going to do whatever it takes. We won't hold back any funds, whatever it takes to fix the problem. These are the people that built our country, our province, and our city. And at minimum, that's the least we can do to make sure they have a safe, clean environment, and that their loved ones that are being taken care of. In saying all that, I just want to mention again, I don't like painting a broad brush across all these long-term care homes. It wouldn't be fair to the good operators. And at the peak, I think it was 22% were infected. So it leaves 78% now. We're even lower than that. I think it's 14% of the homes are infected. So we need to do a better job. Everyone needs to, and we're going to make sure we do it. We've called the independent commissioner. We have everyone, looking at this, but we need their help. We need the opinions of the front line PSWs. We even need the input from ownership of some of these homes. We can't exclude these people. They're part of the solution. We're going to work with the frontline inspectors too. We want everyone involved. This is about making sure we get the job done and resolve the problem, not about pointing fingers. We could point fingers to the last 3, 4, 5 administrations down here. The difference is this COVID-19, we're going to make sure we fix this problem.
Last question.
From Colin DeMello at CTV News. Please go ahead.
Hi, good afternoon, Premier. So the job numbers came out for May. Every single province, other than Ontario, was able to add jobs in the month of May, except for Ontario. Quebec, which is the closest comparison, they were hit just as hard, and they added more than 230,000 jobs in May. What does that say about Ontario's pandemic response, that when every other province was adding jobs, we lost nearly 65,000 jobs in May?
Yeah, but what I'm going to tell you where we're at. We increased 13,000 manufacturing jobs, and believe me, I want to get moving forward, but you just compared us to Quebec, and I'll tell you the reason where the numbers are different is very clear, that Quebec, they closed down all their manufacturing, all of a sudden opened it up in the month of May. They also open up childcare and in schools. So what they do, Colin, and people don't realize it, they'll take one snapshot of a week within a month. But I'll tell you, when we start up, we're coming back with vengeance. We will be at the top of our game as we were before we went through this pandemic. I have the confidence of the people and the businesses in this province. We're ramped up, and I'm going to pass it over to the finance minister for further comments.
Thank you, Premier, and thanks, Colin, for the question. The Premier did just to elaborate, the reference week that Stats Canada used was the week prior to the opening. Of course, as he pointed out, Quebec opened their economy at the beginning of May. We made different choices, again, making sure we wanted to have a safe and a sustainable opening. And notable as well, you would have noted in the details of the report, about 90% of that job loss was in the public sector, so government jobs in Ontario. Those jobs, if you look back over previous months, there was considerably larger public sector job loss in other provinces, including Quebec, including BC, in previous months. So again, reinforcing what the Premier said, we have taken the approach of wanting to make sure that we have a safe and a sustainable recovery. Our opening was the middle of the month, as we've referenced. Early next week, we will be talking about our stage 2. But this is about, in the long term, growing back those jobs that are lost. Any job that is lost is something that we take very, very seriously. Obviously, COVID-19 has created a very difficult situation for families, and we will be tracking this closely. We will be doing what is necessary to get Ontarians back to work in a safe way.
Thank you. And my follow-up question is to the Premier. Premier, hundreds of thousands of people are sitting at home. They may be watching right now, and they're all tired. They're tired of not being able to see their family members. They're tired of being unemployed. They're tired of being stuck at home. They're tired of how slowly, it seems, the province is moving when it comes to the reopening of the province. Do you feel like we are moving at a snail's pace compared to others? Do you feel like we're moving fast enough? I know you're taking the advice of the Chief Medical Officer of Health, but that aside, do you feel like we're moving too slowly here?
I can't say we're moving too slowly. We're moving cautiously, because God forbid this comes back to bite us in the backside. You'd be asking me, you move too quickly. So we're moving cautiously on the advice of health and science. We're going to have a really good announcement next week for the plans of going through stage 2 in the opening. And once we start ramping up, I'll tell you, Colin, we'll make sure that Ontario is humming once again. But I understand some people are frustrated. But the vast majority of the people, I can just tell you the polling I've seen from multiple different companies, you know, we're moving at the right pace.
Thank you.
Thank you, everyone.